So welcome to the ACJ orientation. I'm Dr. Ahmed Hafez, and we have our ACJ expert, Dr. Ulla.
Hi, everyone.
And congratulations, she is licensed and working right now. So,
Finally.
so happy for you. And you're all hopefully on that same path. So today we're going to talk about, they're congratulating you in the chat. So thank you guys.
Thank you.
We have a few groups or audiences that we want to speak to. Of course, we have people that are already signed up for our ACJ. We have students that are coming from our AFK, kind of want to know what the process is like now. Do they wait for their results? We even have brand new people for the ACJ. So we'll try to address all your questions. We're going to talk mainly about the ACJ now and how the course is structured in a short few slides with both our inputs. And then hopefully then at the end, we'll do a proper Q&A for you if you want to have any questions. Even Dr. Ulla will answer anything you guys need at the end. And then that's it. Hopefully you'll get what you need today. Just letting you know the course is starting Monday. That's when the video access starts. So if you want to get your books on time, you should consider enrolling to that course. However, if you are a bit late, the unique thing about our program is you could catch up even if you're a week or two late, right, Dr. Ulla? So that's the thing that's unique here.
Definitely.
All
and
right.
I feel like, actually let's do that after. Let's start with the slide and I'll give a little bit of input into that as well.
No worries. And anytime you want to just say something, your feedback is super appreciated. I know that you have really good tips and stuff, so please feel free to interrupt and just say what you got to say, right? I don't want them to miss out on any good tips what you have. Okay. So just a thing for judgment in general, you cannot teach a person anything. You can only help them find it within themselves. I mean, I don't totally agree, but like I'm saying that in general, in judgment, eventually, I could teach you one day that this is how you see caries, but you're not going to learn it right away. You need time to kind of develop your own judgment and what you think is best, what from in you think is the right thing, and what it looks like caries, right? So you're going to develop that judgment. That's why it's a clinical judgment, right? Exam. So of course, I mean, we will teach you what you need, but it takes time for you to have that skill, to acquire that skill. Okay. So what is the ACJ exam? It's a 5.5-hour exam with one scheduled 30-minute break. You're going to get around, usually it used to be 120 to 150, but now I think the standard is pretty much always 150.
150, yeah.
Yeah. So it's always becoming 150 single or multi-answer, multiple choice questions.
Yes.
Which means
majority of them are multi-answer, multi-choice questions, and maybe a few single answer questions here and there. Maybe like 10 overall on the exam.
And it's a prometric or,
Yeah.
there's a prometric, and there is, of course, a protocol that you'll have in your account. However, the multi-answer here, people that are new, because we've done it so much, it's like we just know it now. But what does that mean? You're going to get, it's a very unique thing you don't see in other exams. You have like around 15 options, okay? And you could have multiple correct answers that give you partial points. So we're going to show you examples of that. Now, if you want to see the ACJ framework, you could go download it from their website. It's still the 2021. There's no updates on it really since then from their point, from the NDEB side. But what that'll show you what the questions look like. We're going to also show you that example so you understand how that works, like what the framework means. So you could download the template from the website if you like. What we do is we will dissect that template and plus more things that we think are important that they could surprise you with. Right?
Yeah, there are a few additions to the template, I believe. Maybe they're not formally included, but we do have them all added in the lectures.
Exactly. That's what we do, is that we go and figure out what those additions are that are not formally added so that you're well prepared.
Yes, and you even have questions that are not necessarily yet added, but we predict that they can be according to the pattern that we see in the development of ACJ questions. And those you will also be familiarized with. So when you get to the point of the actual exam, there's really no element of mystery. I believe in AFK, there's always that element of mystery. Dr. Hafez refers to it as the 5%, right?
Sometimes new questions, or they'll come like with those questions are meant to be not answered in the exam, right? Like brand new
Yes.
concepts. Yeah.
With ACJ, I don't think you'll get brand new concepts per se. It might be a difficult judgment on a few questions, but I don't think you'll get brand new concepts, which is a plus in my opinion.
A difficult judgment. That's a good way of putting it. Like, you know, sometimes there is one where
Things
I don't
that
know what call to make.
controversial
Yeah.
they're
That's
answered
difficult.
differently. Yes.
Yeah. Now, sometimes they do bring the new, like let's say the first time they brought ISDA, right? That was new, but and then we teach it later on. But that's like
Exactly.
very minor, right? Like compared to
The
AFK. I think.
ICDAS, yeah, like one question.
Yeah, like but when it happened the first time it was a surprise, right? Like, whoa.
Yeah.
Yeah, but um yeah, that but you know, that's what we're doing. We're tracking that.
Yeah, I think
What else?
Pedo, we even included all the updates that we saw
Yeah.
and the resto updates in terms of choosing the restorative material appropriate. All of that was incorporated into the course as well.
Yeah, last exam actually, everyone, like people went to the exam feeling it was just like like they felt they learned everything. It was easy. That's how
Yeah.
our students are reporting to us, according to them. And our passing rate went be above 80%. And that's just the general passing rate without any adjustments, right? So that's
That's not I mean, this is something that we can tell you about later. Most institutes would adjust the passing grade according to a criteria, such as how high you actually score in the mocks, for example, and then accordingly, how many of those who scored above this percent actually passed, which is
yeah.
okay. It's okay.
And
It
we
makes
do
it
that too.
easier.
Like we just didn't get that number yet, but we got the general,
You get the general. The
which is
general was
80.
high,
Yeah.
very high. Yeah.
Download the template from the website. So let's talk about ACJ content, right? So the ACJ content, you have diagnosis, treatment planning, and clinical decision making. So you're going to have a case. So this is all the clinical stuff, right? Where it includes pathology, some restorative, not too much, endo, perio, ortho, where you're going to get either a diagnostic and sometimes treatment planning question. So
Mhm.
that's like one sector of the exam. You could put it all in one sector, and you know you're going to get a case, and then you're going to get a question with 15 options. Sometimes there's 4 correct options, each one has 0.25, and sometimes you know it could be 1 correct answer with a full mark. Then
Yeah.
you have a whole other section, the radio, right? And this has grown to take even more of a portion from the
I,
exam,
I believe it's
like 100
currently.
almost, 100 questions.
I would say even maybe more. I would
Like,
say even maybe currently maybe even more. So
mhm.
about 150
Well,
or
total is
130.
150.
Oh, sorry,
100,
about
no,
100. You're right. You're right. It's like
yeah,
75%
so
of
75%
the
of the exam,
75%
yeah.
the exam. Yeah.
So now it's grown to become like people report 100 questions radiology, 50 questions clinical decision making, which is what makes radiology practice really important and what we do a lot of. You have weekly radio quizzes, weekly radio sessions, live sessions. You're going to have, you could say 2 or
Be
3 live sessions every week.
oversaturated. Yeah.
Huh?
They'll be oversaturated, I think.
Yes, you'll
You'll feel good about yourself. You go like, "Oh, I know a lot right now."
exactly. And here's the blueprint that they present. Um, I mean, I always say the blueprint's taken with a grain of salt. We're going to do what we see comes in the exam because you could argue a pathology question is radio if it's a pathological thing in radio. You could argue a radio is an end like. So we don't really necessarily think this is going to help guide you to what to study. Just we know the exam. Dr. Ulla knows the exam. We're gonna and we keep updating and understanding what is important. So we will focus mainly on the parts that will help you pass the exam. Okay. Um, so I could present the course at the end, I guess. I don't have to like show it now. But let me give you guys how the ACJ would look like. So now you're brand new to this. You're used to a body of a question with 4 or 5 options with 1 correct answer in AFK or MCQ exams. The way it comes now is you have this case. So in the case, you'll get, it's really pretty much standard. This is kind of the layout for each case. There's some key points here, like the blood pressure will indicate certain things, the temperature, the age sometimes helps you in diagnosing. For example, they might have here in the allergy section, and what allergies they have in the extraoral section. If they have swelling, that could indicate you need antibiotics. So what is the difference mainly? The difference here is now you have to put the question together in a way. So usually in an AFK question, you have things laid out for you. Oh, this person, here are the key points. They have this. What is the diagnosis or treatment? Here you have a bigger picture. You have to extract the question key points to answer the question,
And this is very much real life, like dentistry, I would say. So you're getting a form, like a short form of patient history, along with a dental history, their actual chief complaint, and according to that, you're supposed to manage, which I think is very important when you move on to practicing dentistry in real life. But in addition, looking at that the first time at least may be a bit overwhelming. I feel.
I find that a lot of sometimes it could be underestimated, like how much problems students actually have with this phase.
Exactly.
Where hey, they know all the information, but it's like they miss extracting the information from the case.
So we like we like to use something we call the CALMS technique, which basically means that we take a few keywords. Through those, we're able to summarize all the information in a good shortcut for you to be able to answer the question moving on.
Exactly. And you could think of it like this too, that in SJ, eventually in situational, you're going to be one asking the questions to get the information. Here they asked it and brought the information, but they brought everything. Now you have to just figure out the key points. And AFK, it's even easier. They figured out the key points and they're just giving it to you, right? So
they give it to you. Yeah, that's right. Here you'll have to understand with every condition, what are the implications of that? And then you have to understand how do they actually affect the bigger picture.
So, and sometimes it does benefit you in reading the question, then, because this case could be presented and there could be multiple questions for it. So for example, it might help to go see, is it a patho question or a perio? Let me go check and then come back to the case to shorten the time it takes to know what information you need, right?
Yeah.
So how does the scoring work? You cannot receive more than 1 mark per question, and you cannot receive less than zero per question. So a lot of people ask, is there negative marking? It's not the standard negative marking where one question takes away from another. That's not here. The way it works here is each question, you could get 0 to 1. That is the range that you could score on each question. So the max is 1 and the minimum is 0. Now, the options in each question, they could, let's say we have a radiograph here and they're asking, maybe it's a bite wing, and they're asking about caries on mesial, on the proximal surfaces. So you could see, look at the structure of this question, everyone. Select 1 or more correct answers. Now, in this one, you could see that you have 1 correct, 2 correct, and 3 correct. And they are distributed 0.3, 0.3, and 0.4, which adds to 1, right?
Yeah.
So let's look at one scenario. Let's say I'm just going to get to the point here. Let's say you answered this one, right? 3, 3, and that's it. So how much would you get? Can you guys, it's pretty straightforward. How much would you get let's start with an easy one from this question.
Basic math question, yeah.
And yeah, just to get them a little bit wake up a little bit. So
all right, there you go.
All right. So that's what you get from this question. Now, let's say you answered this. Now let's take another scenario. This, and you answered this. How much would you get from this question?
Let's see.
Interesting.
Actually.
So the answer here is an actual 0. You get nothing. Pay attention. This is -1, not -0.1. Exactly. That is the shock, right?
So the problem is you can never get a wrong answer and still get the mark of the question, no matter what. So 1 incorrect answer, you lose the question.
The good thing is you don't lose another question.
That's true.
So let's say you answer this and this and this and this. How much do you get from this question? So now you have 4 answers, 2 correct and 2 incorrect. Still the same 0. It's not like it goes less than 0. You can't like over harm yourself in a question. You get what I mean? So now one more scenario which is important is if you answer.
So it's best if you have doubt, just don't mark it. Yes, that's right. That's very, very good way of thinking.
Exactly. They're getting on the right path there. So
they are already, yes.
So if you answer this, this arrow, and then you answer this one that has a 0 on it. What is that? What would that add up to?
You're still getting your 0.6. That's right.
Correct. So what does that mean? There's 3 types of options from a point of view. So one is correct, where you get partial, right, or full. One is incorrect, where you'll lose the entire question. And one is neutral, where it's kind of like, look, we see why you chose that. It's not what we wanted, but we're not going to take away anything for answering that.
There's no penalty on that.
There's no penalty. Okay. So is that clear from what the point system is for each question?
Is that clear how questions are marked?
Okay, good. Now let's get to the strategy a little bit behind it, just to give you a little idea there. So this means what we encourage is you don't want to chase the zeros. You don't want to chase the neutral because they could be wrong.
Don't collect zeros. No.
Huh?
No, don't go collecting zeros.
Yeah, it's like, well, it could be 0. Well, why do I want to chase it? What if it's wrong, right?
If it was -1, we'll lose the whole question.
Exactly. Okay, that's one thing. The other thing is, the way I look at it is, the risk you want to take is kind of associated with how many options you have that you're confident with. So for example, if I have 3 options, right, that I feel 100% about, right? I see carries on this one, I'm 100% sure about that. And there's one option that I am kind of 50-50 about. For me, it's enough to get the 3 I'm sure about and just not answer the one I'm unsure about. Because I want to guarantee, that means my minimum would probably be 75%, which is 0.75, or it could be a full 1 if that extra option wasn't what was actually nothing, right? Now, if I only have 2 options that I'm thinking, right, 2 options, and both of them are 50-50, then at that point it's worth taking the risk, because at that point, maybe it depends on how much you feel that you're confident about that option. If one of them is sure, maybe you just want to pick that one. But if you have like a high kind of, I really think that one is, then it might be worth the risk here, because you only have 2 options total that you're thinking about. Does that make sense to you, Dr. Ulla? Like, how would you might have a different strategy there.
Go with the answer that you're 100% confident with.
Mm-hmm.
Like, what I would say is, imagine you're in front of if any of you did a master thesis and you're defending your answers. So imagine you're able to defend the rationale behind every answer you choose. That's what I would do.
Mm-hmm.
Like, you're able to swear on those answers. When you're completely unsure, and you're, like you said, you're in between 2 answers, then it's okay to take a risk. But when you know that a few choices are 100%er, stick with those. You don't need more, in my opinion.
Yeah, and also to add to that, to encourage you guys to think about is that a lot of times that we see from people coming from the exam is there are a lot of questions where there's only one option.
Oh yeah. You will see a lot of questions with 1 option. You'll see a lot of questions with the answer none of the above. That's also okay. So don't feel the pressure to choose something when you're sure that there isn't anything. Not just because there are lots of options doesn't mean that it's there.
Exactly. Another way of thinking about it is, don't choose things because of why not. Choose it because you are sure of, don't be like, well, why not give steroid? Why not give that? Don't choose the answers that way. Choose it because you are sure of it. And that, just like how Dr. Ulla was saying, like you could defend that answer. Like you feel like if you answered that, it's like you would answer that alone and still have a good it would be correct, you
A
know?
good reason, yes.
Okay, so let's move on from here. The NDEB is using the new perio classification. I mean, it's not that new anymore, but still new relatively, you know, to history. So it's still a bit new. So we'll be teaching you that as well. Here's an example of how perio is. So you'll actually need to read a chart, right? And extract the diagnosis from it. And, you know, we're going to train you on that so you get fast at it as well, right? So you're going to
We'll
have
teach
to...
you tips and tricks to look at the chart once and you'll be able to give the answer entirely.
Exactly. Okay, so the way perio is that, you know, you're going to calculate if it's perio versus gingivitis and what grade and stage possibly from that chart. Okay, so I'm not going to get into that. We have dedicated sessions for it. Endo, and so they're just, this is stuff on the NDEB website that they're aware of the new prophylaxis guidelines always. So for example, if they stop using Clinda, most likely an ACJ is going to be implemented for prophylaxis that you're going to stop using Clinda, right? So they're aware of these things. That's just pretty
I
much
feel like they avoid Clinda in general as a statement, and I
starting.
don't want to generalize it. Like we haven't seen Clinda brought in the picture in ACJ since probably 2022.
Yeah, they're just avoiding the whole, you know, we don't want to get,
We don't want
we
to
don't want to
confuse
confuse you
you.
guys, so we won't bring it at all.
Even for what I want to say, even for like antibiotics, just a regular antibiotic, not even prophylaxis. They're just, but you know,
Yeah,
we'll teach you what you need to know regardless.
exactly.
Yeah.
No, so some tips that I have from ACJ, that's like my personal tips, and Dr. Ulla could share her tips as well, is again, know your limits. Don't try to perfect it. You know, in AFK, there's no harm in trying to perfect it, meaning that every question you should answer. I mean, there's only one correct answer, so why not answer every question and give it your best? However, in ACJ, trying to get 100% could make you fail. So that's why we say don't try to perfect it, right? If you feel like you're confident about two and you might miss a third, sure, miss that third and be okay with losing points of marks so that you don't take the risk of losing the whole question.
You'll notice in ACJ that being more on the conservative side, it's probably a better strategy to passing.
Exactly.
What I advise you to do is throughout the course, you will have a lot of training. So pace yourself. And what does that mean? Use the course to assess. Sorry.
There you go. I got it.
Oh, thank you. So use the course to pace yourself. See, try when you're being aggressive with answering, meaning you're trusting every thought that comes into your head and you're picking it. Check how much you're scoring. And then check the more conservative approach. See when you're actually sticking to only what you're sure of, how much you're scoring. And then you're able to assess how much risk taking is it worth it for you. So that's what I mean. Pace yourself, choose the course, and use every I'm not going to say mocks, but every practice to see how you are. Because some of us, naturally, we are more prone to being risk takers. And some of us, surely, we're a bit more conservative anyway. So that's why I say use this
Yeah.
time to put yourself within the norm that's getting you the higher scores. And then you are more ready for the exam.
Yeah, you
With
don't want to use your adrenaline rush to trying to take the risk here. Like, I could get 100. Let's see, be the hero. You know, like don't be the boring
no,
one. That's yeah. Be the, you know, it's okay. I'm just gonna be conservative, and you'll most likely pass, right?
and you know, like okay, point 8 or 0.6 is not bad.
Mm-hmm.
It's better than -1 or 0. It's better than 0.
Exactly. And especially the questions where, you know, we say pathology is a good place to be good at with radiology. There's a
Yes.
lot of questions where there's one answer, which is just one like piece of effort that could get you a full point, right? So um so let's move forward, read the case, and we'll give you kind of an overview of the structure of the course as well, guys. Okay, it's just soon, and we'll show you what our plan is. Read the case carefully once at the beginning. This is kind of my tip, and review it after reading every question. Now,
Yeah.
I have this because when I see people in the beginning, they tend to forget the case. So they get to the second or third question. Sometimes they forget information in the case. When I was doing it paper-based back in my time, I would forget which question belonged to which case.
You have
So
to
I
go
would
back.
have to, I needed to
Yeah.
go back and make sure.
I think in the electronic form, that is actually kind of help. There's help for you there because
Yeah,
when you get the case is with every
inside.
question that belongs to the case. It's already in
Exactly. So it's a lot
that's
easier, right? So you don't have to do what I did that way, but at least you do want to keep checking the case because sometimes you forget a piece of information like allergy. Just
yeah.
simple as that. Oh, they have allergies. Let me take a
That's why I like the COMS technique. COMS
Mhm.
technique stands for chief complaint, allergy, list of medications, medical history, and social history. And once you cover all of those, the chief complaint includes the vitals. Once you cover those points, I'll teach you how to relate those points to what actually affects the patient. And then you just review that little small part that you put as a note down, and the whole case is good.
Good points. Yes.
Get there. Yeah.
And Dr. Ulla has really good tips and strategies for like actually pretty much all the subjects, but you'll see like good radio and patho, like the details she'll go with you and recognize in patho structures is something that I've seen. Wow, like it's pretty great. So really good feedback about her. She'll be with you every week in this course. She'll be leading the course pretty much. Okay, guys. So that's something I just want you to know as well. And people that were with us in AFK probably have already saw how the teaching method she has is very beneficial, So we're grateful that you're with us here as well. So, and that our
Lovely.
students,
No,
that scholars
I really
have
like
exposure to you,
getting students to be confident enough when they take the exam. It's no longer an issue. It's,
and
I've done
and
this.
that even during your dental work, you're still giving us time to teach in the ACJ. So that's very appreciated.
Come on, we got here through this. I want to get other people to where they want, right?
That's awesome. Yeah. So how many weeks? The course, it's 12 weeks. So we'll be doing a 3 months program. And some people even felt like that each week is almost like a mock because we have almost 100 x-rays plus 4 cases every week that you do on the test invite platform where you could get scoring and you see kind of the different what do you call it, the report system to see like different scores and stuff sometimes. So let's continue with the tips so we don't get into something else right now. Just because it says one or more, we already mentioned this, doesn't mean you have to answer more. So, so the question may say one or more, doesn't mean you actually have to go like, well, I can't just be one. They said one or more. So it's okay if you only have one correct answer, even when it says one or more.
100%.
First look for one very correct answer. This is kind of like look for one that is like this the highlight, the really correct. Only answer more
The
if they are
elephant in the
as
room. That's what I like to call it. Like if you're
yes.
answering the question, don't ignore the elephant in the room. That's gonna have maybe 70% of the question, maybe. And then look for the tiny small stuff. Like you can miss enamel caries, but if there is a huge dentinal caries that's approaching the pulp and you miss that, it's a problem, right?
Mhm. Exactly. That even have it may have more weight.
Of
So it may have
course.
like a 0.8 and then the enamel maybe 0.2, right? So you want to make sure you capture those big like main things that you see. Just to answer the question, it's an full online course that will work online. Like it's with live sessions every week with video content that you have access to. And even the live sessions will be recorded in this course. So it's different a bit from AFK that in the ACJ, the live sessions are actually recorded because they're actual lectures. They're not just Q&As. Okay.
Yes, they're supplementing the course in a way.
Okay. Don't choose using the logic of why not. I already mentioned that to you guys as well. Use the logic, of course, this has to be an answer and must get the select only one answer questions correct as much as possible. Those are like,
Yes.
you
What
shouldn't
one
miss those
way
ones.
that we avoid the why not mentality is we try the 1 minute technique, meaning don't stare at a radiograph for longer than 1 minute. Because believe it or not, even the best of us will start to imagine things in the radiograph that don't exist. So
You can
don't,
start finding things.
yes, yeah. I mean, if you look long enough and anything, I guess you start
I
seeing.
try to use the same technique in clinic as well, so I don't,
Yes, yeah,
you
that's
know,
true. If you
I
look at
do quick,
something, look away
that's
and
it.
then look back, okay, it's not there, move on.
Okay. Um, So the way we look at the topics, as I said, is instead of having it laid out like pathology, perio, endo, then radio at the end, I kind of visualize it like this. Clinical is one thing altogether, and radio should have its own field, like its own
Yes.
pathway, because it is a big chunk of the exam. So we look at all the sections of radio, from caries, calculus, normal anatomy, pathologies, endo. These are the questions that you have in radio that is a big, again, 75% of the exam. And that's why almost I think, no, it's every week we have radio something. Like there's something related to radio every week.
Yeah, a practice of some sort.
Exactly. So we want you to get really good at radio. You'll have 100 questions, discuss those 100 questions. On top of that, you will have some live radio as well on top of it. So I think, like, generally, if you do radio really well and just, you could say for the clinical, not screw it up, you'll pass, right?
I feel like if you do radio, patient management, and patho, you're good.
Yeah.
Yeah.
And one thing I let you know from my point of view is ortho for me, similar to AFK, you could study it and get a question where there'll be differences. Like people come out and say, I saw a class 1, someone else say, I saw a class 2. Or it could just come straightforward. So that's why one of the strategies, actually, don't waste too much time investing in ortho. You might study everything right, come to the exam. Even orthodontists leaving the exam have different opinions on what they saw sometimes. So it's either going to be a straightforward question that everybody agrees on, or it could be a problematic question so no one agrees.
That's the thing. If it was a problematic one, don't focus. Don't waste your time, because it's not gonna have it's not gonna hold the weight of whether you pass or not. I believe if you miss something crucial, for example, a patient who's allergic to penicillin and you prescribe penicillin, I believe that holds more weight than missing maybe it's a class 2 subdivision rights, for example.
And that could be because it's also still a rescaled exam like AFK, where if everybody else gets the thing correct except you, then it might drop your score more, versus if everybody's getting ortho half wrong and right, then it's not as weighted into your score at the end, right?
Yes, and that's not saying that we're not going to study ortho. We're going to give ortho a good, decent approach. But what we mean is, if it doesn't happen then at that day, it's okay. Don't worry. Don't stress about it.
Okay. And part of this course in ACJ How to Pass is learning the right habits, train to choose the correct only. And that's harder than it sounds, by the way. Like some people just can't. They can't let go. They have to choose what, so it's important to get you to a point where you build the right habits in ACJ, where be conservative. And if I teach you that in a week, and Dr. will teach you that in a week, and then you go to the exam, you might still do your old habits. So this is why you need to practice it over time, so you actually form into that. Yes, I want, this is how my nature has become now,
Yes, that's what you say. Pace yourself. And one more thing is, you'll also learn to judge how important is it to recognize the small stuff in this particular question. So every question, you're going to weight it to its own. Let's say if you have a question where you have big 3 big dentinal caries and 1 small enamel one, you might notice that in our answer key, we might miss that one, or we'll give it a 0 in that particular question. And in another question where you have only enamel caries, that same spot, or a very similar looking spot, will have a higher score. It's not about you are unable to recognize it, but it's about how big is that in that certain diagnosis.
In that question.
You'll learn to kind of weight your options.
Exactly. So let's look at how the subjects are, like, how do I view them in this way, how we look at them. So you have a topic or a template, and you know what, just let me give you what a template means, so there you guys know. So the NDEB has templates. So let's say it's template 1 and template 2. Okay, the template has options from A to P sometimes, right? I think so. 15, right? Is there a P in there, or elemental P?
I feel J is the latest.
Maybe
again.
J. Okay, sorry.
Yeah,
I think
J. Sorry.
Yeah.
But,
Okay.
what do I know?
No worries. 15 options maybe, and these options could be, let's say it's a pathology question, so maybe it's linear alba, candida, So this is called a template. That template is usually fixed, meaning like it's the same template, right? The same options in there, they're usually in that order. I'm not going to say for always 100% of the time, but that's what they have released. Now, what changes is the case and the picture. So imagine if I put a picture that has, Candida in it, then you'd answer Candida, right? The answer is within that template. If I put a picture with pemphigus in it, then that should be in the template. It already is in the template. So in ACJ, the strategy is the initial thing is to go look at the templates and study it backwards, meaning, okay, well, they have pemphigus in the template. That means that's a possible question. So when do I pick pemphigus and how do I treat it? Because it's a treatment template. Oh, is there candida in the template? Okay, then I want to study what would the question, the case, and the photo look like that the answer is candida. Oh, there's lichen planus in the template. Do you guys get the point? So you're doing that with every template, right? Now, we also add to you things we know that are not in the template that could come. So don't worry about that. We'll cover it. Dr. Ulla knows those ones pretty
Yeah.
well. Okay.
Yeah, a few things here and there. They're not a lot.
Okay, so we'll also cover that, but this is the strategy of what we mean by templates. So the NDEB has a templates released, and we'll go and dive deeper into the template. So there is a template about investigations, like examination, meaning someone comes to you with pain, what are the initial tests you need to do to diagnose? There is a template about patient management. So they have this systemic diseases, what do you need to consider in their treatment plan? So hopefully you guys get the point. There's a template in perio diagnosis and one for treatment. There's a diagnosis endo template. There's a pharma prescription template, local anesthesia template, and medical emergency. These templates, I look at them as you have to learn and study. They require analysis. So they're more of understanding how to manage them. That's what Dr. Ulla is going to really focus with you on to teach you how to manage these. You're going to have to analyze the case and provide a judgment answer. So you're going to use both knowledge and judgment to answer these questions. And some of them may require memorization. Whoops. Yeah, may require memorization. Now, compare that. Sorry, go ahead.
Sorry, I want to say that there is an aspect of memorization and familiarization. So
I'm getting to that path though. You mean about
oh,
the
you will?
path?
Okay,
Yeah,
go
that's what I
ahead.
did. So this is these specific templates, right?
Yeah.
Then you have ortho and endo X-ray evaluation, where we're going to teach you what you need, study the basics, be conservative. There's where I would say I would be really conservative in both. Like if I find one endo X-ray where I'm sure of an option, I would choose it, and then unless I'm really, really sure about another one, I just wouldn't choose anything else. Same thing the way I treat ortho. So you study lightly, get the basics, and then answer very conservative in the exam. And then to the big, slam dunk here, which is what the pathology and radio is less memorization and analysis and more familiarity. So the analogy I use is like how to remember the faces of people, So sometimes you see someone the first time, you go like, forget that person, how they looked like, what their name was, who was who. You have to keep repeating that until you become familiar, where oh, that's Dr. Hafez, that's Dr. Ulla now. That's you just become familiar with the person. It's not something you learn, like you're not sitting down memorizing the person's, oh, there's their eye position, so I need to know that eye position so I could know that's Dr. Ulla or Dr. Ahmed or something like that.
It's more of a collective view when relating that to a certain diagnosis, I believe. And we're going to teach you tips and tricks for every condition to be able to recognize it.
So there is some of it in the pathology and radio, but a lot of it comes from repetition and practice. Once you keep trying and going, oh, this is the correct thing for this, and this is the correct, it just becomes, you're familiar with that, how it looks like. Right now, when I see a mucocele, I could remember myself before that. What makes it a mucocele? I don't get it. It's a swelling. I'm looking at it from an AFK point of view, describing it, like a swelling in the lip. It could be anything, right? From a theoretical point of view. But now, just seeing it, I know it's a mucocele, right? It just looks like a mucocele, familiar with it now.
Lichen planus. You'll look at it right now. It's lichen planus. There's no other option in your head, right?
Exactly. So you may not be able to memorize here.
Yeah.
It's more requires time and experience, which was why pathology and radiology is important to be repeated a lot, right? Do you want to add anything on to this section?
No, not right now, but I feel like we're going to be adding a lot more. That's practically in the lectures.
Yeah, of course. So I'm just trying to see where, okay, all righty. How long does it need for people to pass? I mean, one cycle we think is sufficient to pass. However, not everybody has the ability to do that if they're, that's why we have the free repeat as well. So there's two things. One is that people sometimes don't get a seat. Some people are, training and maybe they haven't passed AFK, so they're unsure. They're not ready as much, so they want to use another cycle. And some people may just not be able to do it in one cycle. It's just they failed, so they need another cycle. So we do have a free repeat that you could use within a year of your first registration. So if you take this cycle right now in Feb, you could get a free repeat either in the August or the Feb in 2025. That's the maximum time you could use it for.
And I think that's amazing. I think that is amazing, especially for people who are still waiting on their AFK results. I believe this is a huge advantage because you already know that you're going to get the worth out of this regardless. And if you start right now, you know you have a good shot at taking the ACJ exam later on. I believe they have opened a few spots, new spots here, at least in Ottawa recently.
Oh,
So
for the
that,
upcoming?
yes, yeah.
Oh, so is it like
It
fully
was
booked
just
and there's like
throughout
few
the
seats?
past
Mm.
cycle and this cycle. They
Yeah.
have opened those seats. They opened them around the time they opened the OSCE, and then now they utilize them for ACJ. So that was nice. But I
Yeah.
think this is a great advantage that you have throughout this course to do this. I personally, I don't like wasting time and waiting. Dr. Hafez knows I want to take it as soon as I can, get it out of the way. So this is what I would urge some of you to do. Um, and the passing rates right now, I mean, they're on our side for sure.
Like this is the time to, especially even the ACJ in general passing rates by the
Yes.
NDEB, it's pretty good. So it's
Yeah.
a good time to try to go for ACJ.
Mhm.
Yeah, the reason we did this free repeat was really when, back a few years when the whole pandemic thing started and all that. And then people were not unsure of getting a seat, especially after AFK. Like a lot of people here are from our AFK batch just finished. It's either you intentionally delay your ACJ right now or you start, right? If you start, and your AFK results come out as a pass and you get a seat, then you save yourself so much time, right? You're giving yourself that shot of passing the ACJ in May, right? Am I thinking right? Yeah, May.
Yes.
And if you don't get a seat in May, you're maximizing your chance of passing in the following one, which is November,
In
because now
November.
you're studying for 6 months, right?
And
So,
you're still in the loop, which is great for you.
and do you think ACJ, like, let's say someone takes the ACJ, but they fail AFK, do you think it helps kind of like it has some productivity in AFK because you kind of get a narrow view of some subjects and you're like, oh, I already know lichen planus now. I already know. Do you
I
think there's
think
any added benefit?
no, but I feel it adds it kind of now looking back when I passed the ACJ back at my AFK, for example, I felt like, oh no, I know why they're asking about this and this and that. I can
Mm.
relate it to the ACJ. And moving forward, hopefully from the ACJ to the NDECC, you will look back and go, oh, I definitely know why they were asking about this. So yes, there is a continuity. And lots of knowledge from the ACJ does is high yield knowledge in AFK in a way or another. Yes, the format is different, but the concept is the same.
Exactly. And now the one more thing as well is that sometimes they just came out of AFK, they feel tired, right? And what I say is, you know what? If you start studying AFK now without knowing your result, it's going to feel more fatigue because you're studying the same thing. But when you jump into ACJ,
Well,
it is a different flavor. It's almost like
I think
enjoyable
it's
and fun a bit.
counterintuitive to start to study AFK again when you
That's
just
what I was saying in the
no,
group.
it's probably a bad idea. I would advise against that if if I have a vote in it. No, don't do that.
Yeah,
Like,
and
either you relax and take that time for yourself to properly relax, or if you feel some people feel uneasy at staying still. I'm one of those
some people
people.
said that in
Then
the
move
group,
on.
in our
Move
WhatsApp
on.
group,
Start
and I said
something
the
else.
exact same thing you're saying. Yeah. So
Yeah.
go on.
Oh, I'm just saying that, for those people who feel uneasy sitting still, I'm one
Yeah.
of those people. I start with the next step. Be optimistic. It's like yeah.
Yeah. No, it's a good way to be because like you want to keep making progress, taking steps into your journey. That means you're committed for this.
Yeah, exactly.
Empty. Some people are saying empty. They feel empty. Like, what do we do now? And honestly, we have a student actually that did something where, you know her, she was in your batch and she passed the ACJ, Ulla, with you. So,
Yeah.
like in when you're last cycle. So
Yeah.
she took the NDEC
She started
before
ending.
finding out her ACJ result, and it worked out fine for her now. She passed it and she's already started her NDEC, you know, so she's on the right. She saved herself time doing that.
Yeah, she
And
already started when everyone is still waiting for the results. She got, what is it, like two months, I believe, something like that, maybe
I think she started the NDEC
like a
in
month.
the November. She got the result like in December. Sorry, no. She was doing, so here's how it looks like from
Yeah,
so the ACJ exam was like end of November,
ever.
like maybe November 23 or
I
something.
think 23rd, yeah.
Yeah, that time. Our NDEC started early November, right? So she missed all this.
Of course.
And then she did the
Started.
exam and then started and still doesn't know her results. So it's like been maybe, and then somewhere in Jan or December, she got the results from past and she's like, okay, well, that and that like time she used is beneficial,
To
productive now, you know?
practice. It puts her ahead of everyone else who's who's actually graduating at that time to the next step, because it even needs some time to gather your instruments here.
Mhm.
And that's a whole other story for another lecture. Yeah.
Exactly.
Preparation for
So
NDECC. Yeah.
let's move. Sorry, let me
Is
just.
it better to focus on ADAT and wait to start ACJ?
We'll get to that one a little bit later with the plan. Let's just try how long we said judgment. How is your judgment now? That's all like kind of included in how long it will take you. Some people's judgment starting point are better than others. And how fast can you change your habits if you're more flexible than others, right? In changing. So it's all about building the right habits in this. We will review the plan at the end. That will show you. Oh, wait, that's not the right one. So I think we already covered kind of examples. Maybe we don't need to go through this, just like some important information from the case. Dr. Ulla will kind of like hammer this in during the course anyway, so there's no point of talking about it here, but like just an example of how you read the case. Oh, temperature, that'll indicate if there's fever, for example, do you need to give antibiotics?
Mhm.
And these are the things. I'm not going to go through that right now because they don't really fit right now. So what
No.
things they could be allergic to. Okay, so and so just to give you guys, this is kind of for the last cycle, so I don't want to show it here, but I'll give you an idea that our first week videos are around 15 hours and our week 2 videos are around 18 hours. Okay. Now, what I'm going to do is just show you the platform to get an idea of what it's like. Okay.
Mhm.
And, oh, sorry there. And give you an idea about the strategy.
I feel like overall, the study load that you have for ACJ is way less when
Mhm.
compared to AFK, but you get a lot more practice, in
Exactly.
my
Yeah.
opinion. So ACJ is more focused toward practice, and even when you're studying, study with the practice in mind. So you will notice that you will go through the template the first 2 weeks. You'll learn everything that you need to know to pass the exam in 2 weeks, believe it or not. But then throughout the course, you will feel that you're going to go back to that to solidify that information, and relate it to the practical practice.
Exactly. That's a good way to put it. So you could even, if you want to explain how, like I could explain the first 2 weeks here, for example, just to show them the schedule.
Yeah, sure.
So you could see here, once module 1 opens, that's going to be Monday. You're going to have access to the first set of videos week 1. And that's going to discuss the templates. We're going to remember how I told you guys start backwards. This option, when would I pick it and why? What is the question? We're going to do that for half the templates,
Mhm.
and that's around 15 hours of videos. Then in mod and just remember in that in ACJ we don't close videos, so they'll stay open. So even if you come in late, you still have access to them. You could always go back and review them, right? So then module 2, the Monday after, the next set of templates. Just like Dr. Ulla is saying, you're pretty much like, if you could believe everything and memorize everything here, you're kind of ready for the exam. But the issue is learning something and then practicing it are different things. Like some people
Yeah.
just can't robotically take it and execute, right? They have
No,
to like
no,
put it in
you're not
practice.
expected to. So, even
Exactly.
like a small piece of advice is don't be discouraged if within the first 2 weeks you're not getting things right in the practice. It's fine. It's okay. It's normal to take time to build up, to build up your judgment. Or maybe you already have it, but to tune it in, let's say.
Exactly. Now, in every week, you'll see we have live sessions on Saturdays and Sundays that will be recorded as well and
Mhm.
uploaded in the next week. So usually we kind of have 3 sessions in 2 days. So we have a morning Saturday and then afternoon Saturday and then a morning Sunday. Okay. The morning Saturday is usually dedicated to what happened in the week. We call them the weekly tasks. So if you're watching the videos, it's a Q&A about the videos. You have any questions? We might do some exercises. If it's a practice week, like after the module time, then that morning will be dedicated to solving those, right? Then you
Yeah.
have the afternoon session on Saturday, which is lectures that Dr. Ulla will be also focusing on. Maybe it's radio, patho. We have that listed on the platform. And then you have the Sunday morning, which is an additional live lecture that will also cover some topics we do that until we get to the mocks. And then, just keep tuned in to know which lectures are happening when and stuff. But it's usually Saturday, Sunday is the standard. And we have 5 mocks at the end that will be discussed live. Okay. So I'm going to remove the colors here. Give me a sec, just so that. So here's the platform. Here's you have the introduction, the course schedule, all that stuff. The book, you have access to it through the platform as well.
Yeah, so
And the
even
book,
for late registrants, they can still kind of keep up with what we're taking without you're earlier to receiving their books, right?
sorry. Yeah.
Because people who register, let's say today, if they don't get their books by the
Yeah,
time
it'll take a few days. Yeah. So
they can still keep up with the online book.
exactly. So here's the book. You could see how it's template based as well. So you could, for example, the investigation template, here's the template. We go through each option and when you'd want to pick it, right? So again, robotically, you'll be able to answer it if you could be like that, but you need the actual practice to get good at it. And this has been updated recently as well. So we have all the things like even the radiology, all this stuff has been updated here. And we even have, I created some sections at the end where you have some empty pages sometimes where you could take notes from the live. So you'll find it all in here. Then here's module 1. So for example, it shows you here all your tasks you have to do in module 1 in the beginning. So, what the video times are, what you have to do, and then attend the live sessions. Like the main task is watch all the videos, attend the live sessions. And here's the videos that you have. And we have any updates as well that we have in the video could be included as a pop-up. You might see
itself will increase
and
epinephrine.
it'll be like a video note like this. So you'll be updated with the most recent things that we want you to know.
Yes.
So once you finish module 1, we go into module 2. Same thing. You're going to have tasks, finish the videos, and attend the live sessions. Pretty much that. Once you're done the first 2 weeks, you have the knowledge. You have to practice the knowledge now, where the task will change. It will become now, okay, solve the 4 cases you have, finish radio practice 1, and then attend the live to discuss those. And there's just each week maybe a little bit slightly different, right? But you can see
I feel
here
like the first 2 weeks are the ones that are heavier in knowledge.
exactly.
And
Yeah.
from then on, it's mostly practice. Mostly practice and keeping up with the live lectures, of course.
And when you practice, is to go back and use the videos. Like, okay, I screwed up in pathology. How come? Let me go review what the pathology answer was, right?
Correct.
Or you can go back to the book, either way. But the videos will be always open to go back and review what the answers were. So, and this is mobile friendly now as well and tablet friendly. And I think that's pretty much the course summary of how it works. So I'm going to stop there and just see if we're done with the slides. Yep, we're done with the slides. So do you guys have any questions about that? And we could start doing the Q&A with Dr. Ulla as well to answer your questions.
Oh, is there a particular time when the video will become available, say from 9 a.m. every Monday? Oh, so when does the live video from Saturday become available? And
So
Saturday.
the Saturday, Sunday live sessions, when they're recorded, it does take at least a Monday to get them uploaded. So we can't guarantee when exactly on Monday, but by latest, hopefully Tuesday will be uploaded, But if it's not, there could be sometimes technical issues. You have to like be patient with that, but we try to get it uploaded on Monday. We're pretty like that's our data we'll upload. What time? I can't be like I can't guarantee a time, but it'll be uploaded on Monday. That's our goal.
And I urge students to attend, like I know live
Yes.
lectures in AFK, they're very important, but live lectures in AFK are discussing stuff that are mostly included in the course. Live lectures in ACJ are added information. So I strongly advise to attend live lectures in ACJ. They are very important to the progression of the course. And in live lecture, we test something, we test your instant reaction to new materials. So new X-ray, new pathology, what is your instant reaction? What is your instant judgment? And then we discuss why would you go with that and why would you go with this? So you understand the rationale behind choosing what you're choosing. You're not only learning the correct answer, but you're understanding the rationale behind why your original way of thought was wrong or right. Okay? So it's crucial in my opinion. What do you think, Dr. Hafez?
I totally agree. Like I tell them don't plan on like not attending intentionally, you know? So
It's boring. I feel like, oh, I mean, it could be just me, but going in and seeing a recorded version is not the same as being able to interact live
for
with
sure.
the with the person, in my opinion.
Yeah, like you're gonna be put on the spot. There's like a different experience, you know, that you have when you're attending the live. So I would say you want to attend the live, you know, and if just the recordings are as a backup if you really can't, you
Yeah.
know.
Okay. So I'll go back and we can take the questions now.
Yeah.
Um,
I'm just
I
kind of
believe
looking for some samples to show them, but yeah, take any questions you need to. That's totally fine.
so kindly provide an insight into what is the ACJ. I believe we did that. What we need to refer to anything extra or the course material itself? That's a good question. Now, I'll provide some references for the course material itself. So the course material itself is based off textbooks that are on the NDEB reference list that cover the most recent or cover the topics that are covered in the most recent versions of the exam. The course is very inclusive of what is in the textbook itself. But if you're someone who likes to check textbooks, then I'm going to provide you with some references that are worthwhile if you have extra time. But those are supplementary and only if you have extra time. The main thing is you need to cover and know well your course material, and that should be enough. If you have extra time, we will provide you some references. Correct, Dr. Hafez?
We'll provide, yeah, the reference, like the lectures we have so far is like White Pharaoh, Neville,
Uh,
Langlace. Like we covered mainly the main
exactly.
things, but yeah, you could provide them the references if they want to go back. They do have extra time, so if they want to kind of skim through and see if they'll know it,
Yes.
that's fine too. And I could show you guys kind of like how the live lecture will look. Just let me see here. You're gonna see yourself, Dr. Ulla. Is that okay?
Yeah, not
Almost
weird at all.
this shape for verification involvement of the upper, but on the distal side, it's not only involvement, it's furcation involvement, and you can see evident furcation lucency. Okay. Oops. The effective restoration, even the endo. I believe a few people asked me about this. What do you
So just a kind of an example, I could kind of also shed some light on the patho one, just because you'll see like how that feels like.
So even the terms that are present in the templates, we're gonna clarify what each of those terms mean and how do we look for them in the X-rays. Is it more, or actually should I say more common in kids or adults? More common, kids or adults? Adults, good. Good. Can happen with inhaled steroids, but most common in adults. Correct. And the management is topical antifungal.
So even in the live lecture, you're kind of practicing on spot,
no
learning from your
location.
mistakes, you know?
So we do things where we pull up, I call them the polls. You see the picture, you have 2 minutes max to answer the picture, and you have a poll that's raised for 2 minutes that you're going to choose the answer
Mhm.
for. And then we together are going to be able to see how many percentage of you answered option A, B, or C. And then we're going to discuss why, what were those people thinking who answered this or that, and what is the correct answer. Yeah, because
What were they thinking? Yeah.
how were they thinking? It's important to
Exactly.
see why would you think this is a correct answer, and for us to clarify why that's not the case or why that is the case, right?
Exactly. No, it's good. Like being in the session is gonna, there's more value to it. Of course, recordings will be your backup, but it's just like a good polls, like you're gonna get that survey of who answered what and how many, right?
So
Yeah.
what we have here, yeah. Yeah, let me just fix that.
So you can see, you know, you're practicing here pathology, you're
Now,
going into
it
details.
has
You can see the description as well,
probable in females, we know that.
giving you like a
Is it
drawing
symptomatic
description,
or
everything, how to
asymptomatic?
recognize the lesions, you know?
Yeah, and small tips and tricks on every lesion,
For
Okay.
like pemphigus and pemphigoid, where to go this, where to go that, what to look for in the gingiva. I think these are stuff that most people are not familiar with. Lupus versus lichen planus, what do you see?
answer is
Mhm.
D. We'll talk, we'll talk why.
Okay, so you guys got a
This
good
is the
idea
correct
here
answer.
of
Let's talk about
the
every
live
other
lecture.
answer because it's a little bit. Let's see. You went from D, E, F, G, H, I. So
All right. So that's pretty much, I think, enough.
In the live, you are gonna see the poll. That's the thing. In
Yes, you will see the
recorded
poll,
version,
yeah.
you're not gonna, but in the
Yes.
live, you're seeing the poll. So you're seeing what percentage of people answered what, and we will explain that.
All right. So I think from a formal point of view, the set, like we finished that part. So you guys could now ask away.